Hi, everyone. This is week 2.4. Our instructor lectures over the syllabus objective, fully grasp the effects of massage on certain neurological pathologies. There is a lot happening just in this chapter, and the chapter doesn't even cover everything that's out there. It does a pretty good synopsis, but it's way too big to cover in a single lecture and not have your eyes completely glaze over. So I have broken it down into two sections because I already know it's going to be a beast. I'm going to try to go through it with the really important parts highlighted and move onward and forward for you. All right, so today we're going to cover the central nervous system disorders and neurodegenerative diseases. All right, so we have central nervous system disorders is what we're starting with. I'll go over what those are in just a moment. Manifestations of neurologic disease, though, this is pretty important. If your client is displaying any of these, if these are new symptoms for them, then I would highly recommend that you tell them to get in touch with their primary care physician or someone on their medical healthcare team. Things like vertigo, dizziness that is recurring, tremors, fever. Of course, you can't massage with a fever, right? Fever, red stoplight, remember from chapter 1. Impaired mental abilities, any sensory impairment or paralysis, loss of coordination, loss of muscle strength, numbness, burning, prickling, tingling, or itching, which could be accompanied by loss of motor control, right? We learned in 115 that myotomes are responsible for motor control issues, and dermatomes are all of these burning, prickling, tingling sensations that we're going to feel potentially in our skin, down a limb, or on the torso of our body. Persistent headaches, or a headache that becomes progressively worse. This is not always just dehydration or stress or sinus problems. This can be indicative of something way worse, which I will talk about a personal story when we get to that nervous system issue. Acute, persistent, and progressive pain, unexplained radiating pain down the arm or leg. That could definitely signify something going on in a plexus closer to the spinal column. And syncope, which is so the first one we're going to cover is spina bifida. You can download this PDF and read this or read this information out of your book. This is not something that you are potentially going to be working on. You may never even see in your career. This is fairly rare. There are 3 types of spina bifida, but basically it is a congenital disorder that occurs when the spinal column does not form properly in utero and the child is born with a gap in the spine. All right, you can see these various grades of when the spinal column becomes herniated. Like in spina bifida occulta, the gap exists in the spine, but the meninges, all right, the cerebral spinal fluid, here it is CSF or spinal cord, does not protrude or herniate. All right, occulta refers to a condition that is hidden, and most cases are discovered during an X-ray examination for unrelated reasons. So if you are working on a person with spina bifida, it's going to be probably someone with spina bifida occulta. All right, if you have a client whose meninges and the cerebral spinal fluid actually herniates, or even worse, the spinal cord is coming out, that is contraindicated in that area. It's a local contraindication. If it is spina bifida occulta and you are aware of it, you're going to put light pressure over the affected area, which is almost always in the lumbosacral region. Here you can see kind of L5 and the sacrum coming down is what they're trying to show you here in this image. All right. If the client has mobility impairments, avoid passive range of motion, not only because of the possibility of reduced bone density, but you also don't want to be moving, impinging, or jarring anything in here. As you can see in this image C, if you're moving that spine, if they're bending their spine quite a bit, you could be impinging on the spinal column that is protruding in this section. All right, you could definitely get qualified in medical massage, make some cash doing classes teaching parents or caregivers how to massage children that have this. A sign that children have it, just so that you're aware, is either like this patch of hair over the affected region, or right here, as you can tell, this is the gluteal cleft, in case you're trying to figure out what this picture is. And this is an infant, so it looks tiny, but this is the lump made by that herniation, by those meninges and that cerebral spinal fluid coming out. So it has a subcutaneous mass. It's underneath the skin, and it sort of looks like a lipoma. We haven't talked about lipomas yet. Lipomas are benign, basically balls of adipose tissue underneath the skin. We will cover that when we do the integumentary system pathologies for sure. Now, cerebral palsy. I am old enough to remember the commercials in the 80s with that old Southern gentleman for the law firm going, "Do you have cerebral palsy?" And so now it's stuck in my head as cerebral, but it is cerebral. Cerebral palsy. There's a whole generation of us that say cerebral. There is spastic cerebral palsy. This causes muscles to spasm. All right, remember that term, spastic, spasming, which makes gross motor and fine motor movement difficult. And this is up to 80% of cases of cerebral palsy. There's also athetoid or dyskinetic CP. All right, dyskinetic. There's a dysfunction in kinetic movement. All right, dyskinetic. Remember that term. This causes uncontrolled movement. This is when your normal movements become really slow or extremely jerky. It can also be called non-spastic. They're not spasming, they're just jerking and moving about wildly. All right, so dyskinetic and non-spastic are interchangeable. Ataxic cerebral palsy causes gait disturbances and loss of balance. That's where you see difficulty walking. Maybe there are issues actually moving the legs either in proper rhythm or being able to control the movements of the legs while trying to walk. And there is also mixed cerebral palsy, and this is a combination of all three types. All right. This is caused by an inadequate blood flow or reduced oxygen supply to the brain. This happens usually at birth or right after birth. Usually happens in children that are born prematurely. If there are multiple births, like twins, triplets, birth complications, medical negligence, things such as that nature. You could also get mechanical damage from birth assisting tools. Now, massage and cerebral palsy, all right, you want to work around your client in this case. You're going to adapt to their mobility devices if they have any. You may have to do alternate positions like seated or side lying massage rather than doing prone or supine. Butt massage and passive range of motion might help reduce spasticity and improve function. Don't do forceful passive range of motion, though, because people with mobility impairments may have reduced bone density. All right, this is the same for every single pathology that we're going to talk about, where people are frequently sitting in wheelchairs or unable to move or exercise properly and are not putting that pressure, push and pull on their muscles, causing their bones to remain strong. All right. Our bones are where they are because our muscles pull them there. Our muscles are also attached there. The ligaments and the tendons are pulling on that periosteum, making it stronger constantly. Anyone who is not moving enough has the potential for reduced bone density. They no longer have that strength. So you're gonna hear me say it often, but I'm gonna try to limit it, because just know anyone who has an exceptionality that would cause them to be less prone to exercise or fully functional movement probably has reduced bone density. All right. If massage is part of palliative care, if the client is frail, always apply light pressure. This is true of any condition we're going to talk about. If it's palliative care, you're going to want to apply light pressure, and you need to be aware of coexisting medical conditions, like possibly decubitus ulcers if they've been bedridden or in a wheelchair for a long time. Contractures, especially if they have spastic CP or seizures. So please be aware of all of that. If the client is unable to speak or communicate with you clearly, talk to the caregivers about the best communication method, such as blinking the eyes to indicate yes or no, raising fingers, or using something like an alphabet board. I'm not going to cover this in the lecture, but I am providing this PDF for you guys so that you can take a look at this research, this good to know information. If you are interested in clinical studies that have been done on cerebral palsy. Now, I will tell you in this lecture, everything that I have pulled in these research, this is copied out of your e-textbook for you. But I cannot highly recommend enough the Touch Institute of Miami, which will have other clinical studies done on a national or international basis on touch therapy for some of these conditions. So if this is interesting to you, please know that this is only a partial snippet of some of the research that has been done on these particular pathologies. All right. Attention deficit disorder. All right. Attention deficit hyperactivity disorder is ADHD. ADD is the same thing without the hyperactivity and impulsivity component. The exact cause of ADHD is not known. However, research has indicated sleep deprivation and sleep disordered breathing are risk factors for development of ADHD. If you have a child who potentially has sleep apnea, please, for a variety of reasons, that needs to be treated, but it also could be a precursor to ADHD. All right. One thing that would affect you that I have highlighted here is those who are inattentive, don't pay a lot of attention to details, they make careless mistakes, etc., etc. They fail at organizing sometimes, which could lead to forgotten appointments. So if you have a client that you know for a fact that has ADD or ADHD, you're probably going to want to do the reminder calls and texts a little bit more aggressively with that person. So massage and attention deficit hyperactivity disorder. All right. Adapt the length of the session to these clients. Sometimes a shorter session is better. Definitely let them pick their own music. If you're willing to do that, they may have trouble lying still for long periods of time. Um, Sometimes they'll fidget a lot on the table. They will talk excessively. Like I just discussed a moment ago, they will miss appointments. A lot of times they'll forget their wallet, so they won't be able to pay after the appointment. The problem is they also will potentially forget to pay you when they leave and they say that I'll go get my wallet. Chances are they'll have forgotten all about you, not intentionally, but but they may forget to pay you again later. So please be aware of those things. There's also some research for those of you interested in ADHD clinical studies with touch therapy. All right, autism spectrum disorder. ASD is a condition present in early childhood characterized by difficulty communicating and forming relationships. It is called a spectrum because there is a whole lot that goes into this. Approximately 1 in 59 children have been identified with ASD. So when I took anatomy, um, I've taken anatomy a couple of times for different degrees. Longer ago than I care to say, but it was about a decade or so at least ago, maybe a little bit longer. Last time that I took it myself in school for something, and they had cited in a study that it was 150 children to 1. So 1 in 150 children would be diagnosed with ASD. At the time of this book, it's 1 in 59 children. As of right now, I'm sure that number is a little bit smaller because while this book is fairly up to date, it is a little bit behind, um, current day. It's already been published, it's already been reviewed. It's going to sit and simmer for a little bit before we get a new textbook. So this might not be as updated. Now, that being said, all previous subtypes, anyone who had been diagnosed with autism, Asperger's syndrome, pervasive developmental disorder, childhood disintegrative disorder, Rett syndrome, all of those things are now lumped into ASD. So that also is what is increasing the prevalence of diagnosis. There are signs and symptoms. They're not super, super important to you because they range so differently. And this is describing children more than adults. And you'll be seeing more adult clients with ASD than you will children. But it is here for you if you would like to pause this and read this. Massage and autism spectrum disorder, the things that you really ought to know. So if this is the client's first massage, you need to have an extensive conversation with them about intolerances to touch, hypersensitivities to sounds, smells, and textures. All right. And make your modifications as needed to the treatment. You might want to do shorter massages until this particular client is used to it and you see how they tolerate massage. It is also helpful to tell the client everything you are doing and why you are doing it throughout the treatment to reduce stress and unpredictability related to social touch. A lot of times, not only are they adverse to being touched, they are also adverse to contact with strangers. So you have a double whammy. I'm laughing because this is one of my problems. I am on the spectrum. And as hilarious as it is that I love to give massages, I am incredibly I find it very difficult to get them, especially from people that I don't know. Uh, I don't know why. It's just part of my makeup, apparently. And this is very true. When you are explained to what is going on and you have an understanding of what is happening, and this is true for people with anxiety disorders as well. Explain people with trauma, people who have been mugged or sexually assaulted, no surprise touches for any of these people. We don't want to give them a panic attack or anything of that nature, all right? Another thing to keep in mind that I have highlighted here for you is individuals diagnosed with ASD may have a preference for deeper or stronger pressure, which may reduce touch aversion, slow, strong, steady strokes, all right? It's going to reduce the touch aversion, nervousness, and anxiety. When you're using quick, tickly touches, soft touches, it's going to stimulate the fight or flight system in them. They are going to either feel like they're being tickled or attacked. Whereas if it's slow and it's steady pressure, it's going to feel comforting, sort of like someone who has anxiety using a heavy weighted blanket. All right, here's some research that I've provided for you about ASD. On to seizures. Seizures are not always necessarily epilepsy. There are different kinds of seizures that you need to know about. There are focal seizures, also called partial seizures. All right. This is when seizure activity is limited to a single area of the brain. All right. Seizure disorders, by the way, are uncontrolled and excessive electrical activity in the brain, and they cause a sudden disturbance either in muscular function, thought disruption. Very often, the event is described as a lightning storm in the brain. All right, now there are two types of these focal seizures. There is a focal seizure without the loss of consciousness, all right? These types of seizures may change the way things look, like that people might see flashing lights, or they may jerk their arms, or they may feel an abnormal sensation like dizziness or electricity. And then there's a focal seizure with impaired awareness. They involve a change or loss of consciousness or awareness. The person might have a blank stare or start performing repetitive movements like hand rubbing, smacking, or chewing, or they might start to walk in circles. Generalized seizures involve a more diffuse area of the brain, and there are absence seizures that are generalized and tonic clonic, all right? The absence seizure is what we call a petit mal. These involve a brief loss of awareness and some transient facial movements that last for up to 10 seconds. All right. And then they start doing what they were doing before and they have no memory of what occurred. My best friend in high school had absence seizures multiple times a day. So we would just be walking down the hallway to go to class, and she would just either keep walking and walk straight into a locker, just staring and just kind of keep walking, completely unaware of what was happening, or she would just suddenly stop and stand there with a blank look on her face. So it was very dangerous for her to do things like cross the road, and she was not allowed to drive a car for obvious reasons. A tonic-clonic seizure is a grand mal seizure. These produce an intermittent contract and relax pattern in muscles, and they have a loss of consciousness. All right, an initial generalized muscle contraction is about 10 seconds long, and then it follows with alternating contraction and relaxing muscles, which lasts several minutes. They will usually also have no memory of the event. All right. Status epilepticus occurs when seizures are recurrent without a full return to consciousness from the seizure or a single seizure lasting more than 30 minutes. All right, this is a medical emergency because you're getting brain damage and potentially death from lack of oxygen in this particular case. This could occur when the person discontinues anti seizure medication or other medications. It also occurs sometimes in untreated people with seizure disorders if their treatment is not working for them. All right. So, absent seizures, we already talked about transient facial movements, eye twitching, blinking. They might have a blank stare when being spoken to. Tonic-clonic seizures, again, are the intense ones. They have visual or auditory sensations occurring minutes before the seizure begins. So sometimes they have a clue of when this is going to start. And then during the tonic phase, all right, like we talk about muscle tonicity. During the tonic phase, general muscle tone increases, muscular contraction begins. That's that first 10 seconds we were talking about, and it holds. If the person is standing, they're generally gonna fall down to the ground. A cry might be heard as the thoracic and abdominal muscles contract, forcing air out of the lungs, all right? It's going to be a yell or a scream that comes out that's just literally caused by the air being forced out of the person. Then they have the clonic phase, which is the manifestation of alternating contraction and relaxation of the muscles. And then they have increased salivation or foaming of the mouth, and they might lose control of their bowels or their bladder. This happens usually for several minutes. The person becomes confused, weak, and drowsy. And when they come out of this, they have no memory of the event. The post-seizure phase is called the postical stage and can last for several minutes to several hours. All right. If your client, this is massage and seizure disorders, what you need to know, if they have a history of it, ask about triggers. All right. Ask if they are continuing on their prescribed anti-seizure medications. Ask who to contact if they have a seizure. Sometimes they want like their mom or their husband or somebody called before you call 911. Ask how long the seizures last. And if this is a client's first seizure that they have with you, make sure that you not only refer them to a healthcare provider, but you're potentially going to have to call 911. People with epilepsy, this is someone who experiences these grand mal seizures, these tonic-clonic seizures, or absent seizures over and over and over again. All right. They usually have some triggers like contrasting light and dark patterns, flashing lights like strobe lights. Your ceiling fan might potentially cause that effect as the fan blades move, creating shade and light, shade and light, shade and light, and could trigger a seizure. Certain odors can trigger a seizure. So you might not want to use aromatherapy. The Epilepsy Society recommends avoiding rosemary, fennel, sage, eucalyptus, hyssop, camphor, and spike lavender. All right. Lavender, rosemary, and eucalyptus are extremely popular. Camphor is usually in the muscle icing gels, things of that nature. So please be aware, most of your muscle creams are probably a contraindication for people with epilepsy. Here is a breakdown of tonic-clonic seizures and what the phases are so that you can get a close-up view with some imagery here and also some research that's good to know. Seizures and first aid. I'm not going to quiz you on this, but this is extremely important for you to know in case this ever happens in your office. So it will be available in the PDF, or you can just pause me right now and read this over. Traumatic brain injuries, all right? TBIs. Usually someone will say, I have a TBI, or they'll put in their intake form TBI, and you're probably like, what is TBI? It is a traumatic brain injury. This can be a concussion, a contusion, or a coup contra coup injury. All right, a concussion is where the brain accelerates in the direction of force and then it decelerates. It's been hit. All right. That's this middle imagery down here at the bottom. The contusion is more serious than a concussion and involves bruising or bleeding along the brain surface or just below the surface. The extent of brain damage depends on the size and location of the bleed and the time that it lasts. A coup contra coup occurs from significant impact, causing the brain to slam towards the front and back of the skull forcefully, which damages both sides of the brain from the impact. This usually happens in serious car accidents, forceful blows to the head, and of course, acts of violence, which would be forceful blows to the head. All right, massage and traumatic brain injuries. You do not do massage until the client is in the rehabilitation stage, all right? You do not do massage until they are being rehabilitated. When this is a fresh injury, massage is contraindicated. You need to ask them about the extent and severity of their symptoms so that you can modify the massage, all right? Again, use the fingers, use an alphabet board, writing, whatever you need to do to be able to communicate with your client effectively. Make sure that your face cradle is comfortable for them for staying in that position for a sustained period of time. And obtain verbal, or if they can't verbally consent, however, way you have set up communication with this client, make sure that you have enthusiastic consent before touching their face and head after this. Not only could they have limitations to movement because of this injury, but they could potentially be emotionally triggered after something traumatic happening to them and then having someone touch those areas. If they become dizzy, limit changing their positions and avoid techniques that cause them to rock or shake. You can make that dizziness quite a bit worse. All right, spinal cord injuries. All right, these are either direct injury to the spinal cord or could potentially happen from damage to surrounding bones, tissues, blood vessels, etc., etc. The signs and symptoms, the two things I really want you to pay attention to here, because we have covered paraplegia, quadriplegia, tetraplegia in other assignments, is I want you to pay attention to flaccid paralysis. This is when the skeletal muscles become flaccid with people with spinal cord injuries. Also, muscles can turn from flaccid to spastic. Remember, we were just talking about spastic cerebral palsy when someone contractures up because their muscle is spasming. That is spastic paralysis. That is when your muscles become contractured. All right. There's loss of movement and sensation, characteristic of paralysis, but they might start experiencing pain as nerves may begin to heal or the compression stops and feeling starts to come back into those nerves. Unfortunately, it's not usually a nice feeling. If your client is on medications, please be aware of what these medications are. I know we covered medications in chapter 3, but these are some that I want you to be aware of today. Medications to reduce edema, to get body fluid out of the body, is called a diuretic. They could also use corticosteroids that will help with inflammation and reducing that edema. You can control blood clots, which is a coagulation of blood, by taking an anticoagulant. All right. Medications used to manage the effects of spinal cord injury are things to control pain, which are analgesics. All right. Analgesics and muscle spasticity. We want to reduce those spasms. So you take a muscle relaxant. All right. Massage is postponed until the client is past the spinal shock. All right. You have to wait until they are in the rehabilitation stage before you can work on them. And of course, ask them about the severity of their condition, make accommodations, especially if they're in something like a wheelchair. All right. Avoid deep pressure over the bones and forceful passive range of motion because of the possibility of fracture, which has been reported. Also, avoid vigorous massage techniques on the legs because of possible blood clots. Here's some research, good to know. Here's some imagery of some compression fractures from force. This would definitely end up being a whiplash injury here, as well as some ruptured ligaments. It's pretty intense, but here is some research on spinal cord injuries for you. All right, brain and spinal cord tumors. Tumors, in this case, we're talking about malignant tumors, not benign cysts in the brain. There are a couple of different types. They can be primary or secondary. If they are a secondary tumor, they have grown in there from something else. These are called metastatic tumors. When cancer has metastasized inside the body, either from the breast, the colon, bone, something like that, then they travel and they grow elsewhere in the spinal cord and the brain. That is when cancer has metastasized from somewhere else. Brain and spinal cord tumors differ from malignant disease in other parts of the body because if they originate in the brain or spinal cord, they don't usually metastasize the way that breast cancer or bone cancer would because there are no lymphatic vessels present. Cancer is usually spread through the lymphatic system. However, even though they don't metastasize, they carry an extremely high mortality rate, meaning that they are a lot more fatal than other types because of their location, right? You're pressing on things like the brain and spinal cord, which is the control system for your body. All right. You can get signs and symptoms of headaches, visual disturbances, dizziness, anything that you would imagine would happen with issues with your central nervous system. All right. When massaging these clients, please be in touch with their healthcare team and be aware of their current signs and symptoms as well as the side effects of any of their cancer treatments. All right. That was a synopsis of central nervous system disorders. Now we're going to touch on neurodegenerative diseases. All right. The first one would be dementia. This is a group of neurodegenerative diseases that slowly destroys memory, thinking, and communicating skills. All right. There are several types of dementia, but they all sort of have the same signs and symptoms. It'll start as forgetfulness, loss of memory. They'll get personality changes, excessive emotional reactivity, or rapidly changing emotions called emotional lability. All right. That's one for you to remember. That's why it's highlighted in yellow. Disorientation and loss of cognitive abilities. All right. You're going to adjust your massage according to the client's wishes, which might change abruptly. You could be massaging their back, and they could be loving it. And then suddenly they yell out, "Stop touching me there. I want you to do my feet." Roll with it with these particular clients, please. Acceptance of the client's behavior is important because these individuals experience personality change, which worsens over time. All right. Ask a caregiver or family member for ways to calm the client in case they become anxious or combative. I would highly suggest if you have a client with dementia, if you're working in a private office. Now, of course, this doesn't really apply if you're working in a hospice or a nursing home or a hospital. But if you're in a private office, working with a combative client is not a safe situation for you. You don't have a healthcare team to rely on, and there's not usually a safety system set in place like there would be in like a nursing home facility, or a hospice or a hospital. All right. You can definitely use calming music. Obviously, pay attention to their coexisting conditions. Anxiety is one thing to deal with, but rage and combativeness often get worse in dementia. So please be aware of that with your clients. All right. You can pause here if you'd like to read this. This was pretty cool. It's the deterioration scale for assessment of primary degenerative dementia. You can read this and wonder which one of your family members is on what level. I know I have done this reading this book every year. Now we're going to move on to Alzheimer's disease. All right, Alzheimer's disease, named after the German neurologist who has discovered it. This destroys memory and thinking and communicating skills. It This mental decline interferes with work, social activities, and abilities to perform activities of daily living. This one is a little bit different than dementia, although it has dementia symptoms. This actually has formations of these amyloid plaques that you see in here, and actually has extreme changes in the brain. Um, Proteins will organize themselves into irregular knots that are called neurofibrillary tangles, all right, which are toxic to the cells, and they disrupt synaptic transmission. Remember from 115, you have two synapses here, all right, and neurotransmitters and electrical and chemical communication go back and forth to tell your body what to do. It disrupts that so that your nerves no longer talk to each other. Okay. As the brain tissue is destroyed, ventricles start to dilate and the grooves widen and the elevations narrow. So, I don't know if you can see my mouse circling this healthy brain and this severe Alzheimer disease brain here, but you can see the physical changes that have occurred as the brain um, heights begin to shrink down and those ventricles widen, causing all of these gaps and basically a shrinkage of healthy brain tissue. All right, genetic factors are in less than 1% of cases, but head trauma, poor sleep patterns, here we go, sleep apnea again, lack of exercise, obesity, smoking, secondhand smoke, high blood pressure, and poorly controlled type 2 diabetes have all been seen as major contributing factors. All right. One of the signs and symptoms of Alzheimer's disease is confabulation. Um, it is a loss of memory or memory distortion. This person creates false information they feel is accurate to fill the gap in memory. There's also a loss of smell is an early indicator of Alzheimer's disease. They have excessive emotional reactivity, rapidly changing emotions. Again, remember from the other page, that's emotional ability. As they go through all of these 7 levels, that is located right here. It's the same for dementia. All right. Massage. Make adjustments just like you would for dementia. Late stage adjustments, you really don't have to do a lot. If you walk into a room and the resident's already sitting in a recliner, just massage them in the recliner. Don't ask them to do things. Work through their clothing. Um, Communicate with them. Just take them as they are. We're not going to try to do the whole rigmarole of getting onto the massage bed and doing a full routine once they've hit these later stages. We're just going to try to work on what we can, in able to get their circulation going and getting some range of motion and movement in those muscles for them at that point. All right, here's more research on Alzheimer's disease. If you would like access to that, if you're very interested in this particular topic or have family members that are suffering from it, so you can definitely pause this here and read it. Parkinson's disease. It is a neurodegenerative disease causing abnormal movements like tremors, rigidity, slowness of movements, and postural instability. All right. Neurons deteriorate in a section of the midbrain called the basal ganglia. All right. So these neurons usually produce dopamine, which is a transmitter regulating voluntary movements. Dopamine is also involved in emotions, mood, and motivation. It is what I call the motivation neurotransmitter a lot when I talk about it. The thing that makes you want to strive towards the goal. You get serotonin once you reach the goal, but getting to the goal, you get a ton of dopamine. A fun fact, I think I've mentioned this before when we talked about medications. Medications to give you extra dopamine if you have Parkinson's could cause schizophrenia, and medication to treat schizophrenia could cause Parkinson's, because they both have an issue with dopamine regulation. One is too much, one is too little. Right? So Parkinson's is caused by a decreased level of dopamine. You increase that dopamine too much, you get schizophrenia. You have schizophrenia and you try to lower that dopamine, you get Parkinson's. So it's a very interesting spectrum. All right. What I want you to pay attention to here is the triad of symptoms that are resting tremors, rigidity, and a slowness of voluntary movements is called bradykinesia. All right. Now, remember when we talked about hypertension is high blood pressure, and hypotension or bradycardia would be like low heart rate. Tachycardia is high heart rate. Bradycardia is low heart rate. All right. Bradykinesia is difficulty, a slowing down of movement, a lack of being able to synchronize movement. All right. So remember that term, please. Chewing and swallowing become difficult, causing drooling. Why did I highlight that? If you have someone with Parkinson's or has an issue with swallowing, please be aware you might want to put like a little washcloth or extra little face towel down on your face cradle to collect some of that drool. Maybe even one on the floor, because when they put their face through the hole, all right, it's going to drip down on the floor. That has happened to me before. I had a client dripping literal snot out of their nose on the floor. Bad memory. Anyway, please maybe put something on the floor for real, for these clients, but also have like a little clean rag or washcloth or tissue, that they can also wipe the corners of their mouth with, because potentially they could be drooling and literally unable to control it. All right. Massage on Parkinson's disease. Allow more time for pre and post massage activities like changing their clothes, getting on and off the massage table, it's going to take them more time to get up and dressed. Um, Sometimes you really just ought to do it through the clothing, considering them in one, massaging them in one position, like staying supine the entire time, or prone the entire time, or side lying, because rolling around and moving from position to position might really be difficult for them. All right. Things like passive range of motion, foot reflexology, and abdominal massage are all excellent things, especially if they're having trouble going to the bathroom. Abdominal massage is amazing to help people with things such as constipation. All right, here's another thing that's really important, not only for Parkinson's, but anybody with mobility issues in general. Be diligent about safety and provide a barrier free space in both the office and treatment room areas. Now, I have two rooms with rugs. All right. This suggestion is that setting the electric lift tables low enough so that the clients can place feet flat on the floor when they get off the bed. Um, do not have bolsters or supportive cushions on the bed. It's hard for them to swing their legs over them. Remove throw rugs, secure carpet edges, avoid having waxy floors, low furniture, things that they can hit their shins on, objects on the floor, cords, wires on the floor. Have a raised toilet seat in your bathroom if you can, and make sure that you have the lights. Like when these clients get up from the bed, um, don't leave the room dim when you leave. Turn the brighter lights on so it's easier for them to see. Now, why did I put up these two images and they both have rugs? This is a throw rug here on the left with trippable edges all around it in front of the door. The rug in this room on the right extends all the way to the curtain they have on the back wall where the client shouldn't be walking past, and is all the way around the massage bed, so it is not a trip hazard. There is one tiny cord you can see sticking out from underneath this table, but a client would literally have to stick their leg under the table. There's no bolster on here. They can just slide right under the sheet without having to lift their legs for anything. On this room on the left, we see the stool in the way there. We see multiple cords plugged into an extension cord here on the floor. We see this door barrier they probably put right here for sound and also for, a draft coming in. But that's a trip hazard where it's laying. While they do have a bolster on the floor and not on the table, they have this pillow and such on the bed. Client is not going to be able to throw their legs over it if they have Parkinson. All right, ALS, amyotrophic lateral sclerosis. All right, this is degeneration at its finest. This is also called Lou Gehrig's disease after the baseball player who died as a result of this disease. It is a progressive degeneration and demyelination of motor neurons in the brain and spinal cord, causing you to lose muscle control. It leads to paralysis, and it eventually makes the person completely immobile. All right, amyotrophic. It's a word you need to know. Amyotrophic means muscle wasting, and lateral sclerosis refers to the hardening or sclerosis. Sclerosis is hardening of the lateral pathways of the spinal cord. All right. ALS progresses super rapidly and is fatal. Usually people die within 2 to 5 years after being diagnosed. They do retain their faculties. They do not get things like dementia. They have their full intelligence and full sensory function, so they can still feel everything and they can still think everything, but they cannot express it sometimes if they're unable to communicate properly due to loss of muscle control. Now, it usually begins with weakness and atrophy of the hands, forearms, and legs that then spreads to involve most of the body, and it progresses to paralysis. They also have difficulty with speech, chewing, swallowing, and breathing. So while you would definitely be able to perform um, massage on someone in the beginning stages of ALS. As it becomes progressively worse, you're going to want to do it with a healthcare team involvement, and possibly in a facility where you have assistance, if your client is in any medical distress while you are working on them. Because this is a progressive debilitating disorder, massage is palliative care in this case. So you're really trying to work on reducing pain, and helping with relaxation. You want to make sure that the client is comfortable, using appropriate cushions and bolsters to make sure that they are in positions that are comfortable to them, which may not be normal side lying, prone, or supine positions. Use light pressure. And again, remember my little speech, do not do forceful passive range of motion, because people with mobility impairments have reduced bone density usually, all right? If they have speech impairments, make sure that you are able to communicate with them effectively. All right, MS. This is another demyelination issue. I have an image here, of the myelin sheath that goes around the axon of, the nerve cell here. And you can see how this myelin sheath is, being eaten away, basically. All right, multiple sclerosis is degeneration and demyelination of neurons of the brain, spinal cord, and cranial nerves, especially of the octave nerve. All right. It leads to scarring or sclerosis, hardening, and plaque formation, which interferes with nerve transmission. Your book describes it like an electrical wire having its insulation stripped off of it. All right, this causes sensory and motor abnormalities, and it also goes along with cognitive dysfunction, in MS. And the cognitive dysfunction can appear early in the disease. All right, this includes decreases in information processing speed, word finding, concentration, and attention. MS worsens over time with periods of remission and exacerbation. All right, this is a relapse or a flare up, remission, exacerbation. All right, these are words, that you should know. In fact, I'm going to highlight them right now, because you need to know these: remission and exacerbation, a relapse or a flare up. All right, with each exacerbation, new additional areas of the central nervous system become affected. Speech and impairments develop. Please be aware, even in the early stages, bladder and bowel dysfunction occurs in up to 80% of MS patients. So if you have a client who has multiple sclerosis, maybe consider not only the extra towel for potential drooling for trouble swallowing, but also a waterproof massage bed cover, for possible incontinence if they are not wearing, some protective underwear while laying on the bed. Please be aware that that is a potential possibility. All right. You need to assess them at every visit, because the symptoms change from day to day with this. If they're having a period of exacerbation, massage applied slowly with light pressure can be performed. Please consider foot reflexology in all of these neurological issues, and aromatherapy to improve treatment outcomes. I believe that epilepsy is our only major no-no for aromatherapy. There is a lot of research on MS and touch therapy here from your book. But again, I remind you to check out the, Touch Institute of Miami and their research studies for more information. All right. Our last one for today is Huntington disease, named after the surgeon, who discovered it. It is a neurodegenerative disorder causing motor, cognitive, and psychiatric disorders. All right. Most people with Huntington disease develop signs and symptoms in their 30s or 40s. They may experience involuntary, purposeless, and rapid or jerky movements called chorea. All right. It looks like chorea, but it is chorea. You don't pronounce the H of the arms and face. So they might just have like strange faces all of a sudden. All right. Sometimes they're mild and they range from flexing and extending the fingers, raising and lowering the shoulders. They might start tongue smacking or grimacing. Eventually, this affects the entire body and it leads to full postural instability. All right. Speech difficulties become common, mental and emotional processes become impaired, followed by progressive dementia. All right. Inquire about positions that are most comfortable for the client, which might include using cushions to ensure client comfort, alternate positions because they may not be able to do prone or supine properly, and please apply light pressure. Again, don't do forceful passive range of motion or downward pressure with deep tissue because of potential reduced bone density. And if they are unable to speak to communicate clearly, please make sure that you have an alternate way to communicate effectively with them. All right, guys, that is all I have for today. I hope you learned something interesting, or at least have something that you are interested in researching for the future, especially my future medical massage therapist. And I will see you for part 2.